Okay, in keeping with our disaster theme, I'm going to talk about explosives today. Um, this is the E of CBRNE. I'm sure you guys know this really well. We see it all the time. But we're going to talk about explosives. So the first thing I want to say is that I'm going to speak specifically about explosives only, but remember that you can have mixed events, right? If there's radioactive material packed in with the explosive, you're going to have to deal with both things. But I'm only going to talk about explosives for education reasons, but just realize they can be mixed with infectious stuff or radioactive stuff or other things in there. So there's a lot of different things that we can use as explosives. There's blasting agents and all sorts of bombs that you could build. I do not recommend you Google how to do this stuff. It'll flag you and get you on a lot of list servers you don't want to be on. I know I was not allowed to travel through certain airports for a certain time period. Doesn't help them traveling with a Palestinian, but I was not. I was on a list and I got pulled out more than once when I was traveling. Um, When you look at explosives, these are chemicals or substances that are solid or liquid. And then when you ignite them or start them to change phase, they generate a lot of gas, a lot of heat, a lot of pressure, and probably also a loud sound coming out. So they go from a small form to a very large form very, very quickly. That's how they create the energy and that's how they create destruction. So there's really two types of explosive agents. There's nuclear, which I'm not going to talk about today. This is, excuse me, your fusion and fission. And then chemical reactions, which is what we're much more likely to see, which is like nitroglycerin or TNT, something like that. So there are two kinds of explosives. There's low order explosives and high order explosives. Low order explosives are stuff like ammonium nitrate fuel oil or gunpowder or pyrotechnics. And this stuff, when it explodes, it goes slower than the speed of sound. So the waves of the explosion hit you in the order that they were generated. Right? This is less dangerous and probably more common to see and probably easier to get. Your high order explosives explode over the speed of sound. And this is really important because as they come out as a wave, everything hits you all at once. And there's a lot more energy hitting your body and therefore a lot more destruction going on. And these are stuff that's detonated. These are like TNT, C4, which I actually didn't know was compound 4. I was looking it up. But these things do a lot more damage because you have all the energy all compacted into a small time frame, and that's what's destroying your body. So if you were to put a sensor a certain distance away from an explosion and measure pressure, you would see that there would be your explosion, and then a certain time away, probably milliseconds, you would have until this huge pressure front hit you. And the pressure goes up very, very quickly. And that's what causes a lot of damage to you. And then as the pressure front goes past you, the pressure drops down almost as quickly, but then has a negative pressure trailing behind it. And this is important when you look at the different kinds of injuries you can get from explosive injuries. So we're going to talk about primary, secondary, tertiary injuries of explosions and learn which do what to your body. So your primary injuries are caused by the actual blast front, the pressure wave, as it's hitting your body. And because it's so brief, it doesn't really get a chance to do that much damage unless it's hitting something with air inside it that can deform very easily. So if you think about it, what parts of your body have air inside it that are sort of not protected? Your eardrums, your GI tract, your lungs. These are all things that are air-filled structures that can be pretty easily destroyed when a pressure wave hits you. So your primary injuries are caused by the pressure wave and the pressure wave itself. Realize it can cause damage to anything that has differences of densities. So your brain has a lot of different densities in there, and it can move the cells and the fibers differently depending on what density it is. And this is why these pressure fronts also cause concussions and traumatic brain injuries. If you think about it, it's important if you're in a closed space or a big open field. If you're in an open field, the pressure wave is going to hit you, go past you, and it's gone. But if you're in a closed space, that pressure wave is going to hit you, hit the ceiling, hit the wall, bounce off and come back at you and hit you a second time and a third time and maybe 20 times in a split second. This is all more damage that your body is absorbing. So this is why when they put a bomb inside a bus, you have a lot more casualties inside that closed space than if it was inside a field, like in a mall or a shopping area, something like that. So looking at TM specifically, as that pressure wave hits the TM, it deforms it to the point where it may rip. So it's very common to have TM injuries and blast injuries. So you have to look in every single patient's ears when they're in a blast injury to make sure they don't have a torn TM. Realize too, it can affect the ossicles. It can either dislocate them or break them. So look for that as well. And this is where your Weber and Renee tests come in. I'm sure you guys remember all these tests from medical school, where you're testing for conductive hearing loss versus neurologic hearing loss. All right, blast lung is when the blast wave hits your chest cavity and your lungs are obviously filled with air. So it's going to hit all those alveoli and all the alveolar walls and destroy them. And all these little injuries group together to form one big injury that sort of looks like ARDS. And you have to be really careful when you're treating these patients, because if you give them too much fluid, they're going to get real soupy and wet in their lungs. But if you give them too little fluid, their pressure is going to drop out and they're going to be under resuscitated. So you really have to be really careful in how much fluid you give them. Some people recommend that you watch urine output to decide if you're giving them enough fluid or not. You want to keep them at the bare lowest you can do while keeping them healthy. Notice too in this X-ray and the CT that most of the damage is limited to the middle of the chest. And that's because as the blast wave hits you front on, the stuff on the sides gets deflected away by the angle of your chest wall. But the stuff that's flat will deform the front of your chest, and that's where most of the energy is absorbed into your body. Hollow organs also have air inside them, so they also take a lot of the brunt when you're being hit by a blast injury. And they may perforate you right away if you're close enough to the blast, but it may just cause shear forces in the walls that destroy the wall, and therefore you don't see it right away. You're going to see it a little bit later. So they may be 2 or 3 days out and get really bad abdominal pain. That's because something is perforated later on. So you can't just say, oh, your belly hurts, you know, we'll CT you, there's nothing there, you're good to go. If they develop pain later, they probably deserve a second CT to look for perforation or even just an upright plain film. All right, on to our secondary injuries. So as the blast wave goes past you, that negative part of the blast wave is going to pick up all the junk that's in the environment. That could be sand on the floor. It could be nails that were packed into the box around the bomb that went off. It could be anything in your environment. So that negative pressure part of the blast wave picks up all that junk and drags it behind the blast wave. So when all that stuff hits you, that's your secondary injuries. And these are actually the most common, most numerous kind of injuries that people get from explosions. So if you get hit by something like a nail or a small rock, it could be penetrating trauma. But if you get hit by a big brick or the door of a car, you can see how that would be blunt trauma. So secondary injuries can be either blunt or penetrating trauma. The eyes are really susceptible to this stuff because you can get little tiny grains of sand. You can get a lot of stuff that'll penetrate your cornea and penetrate your eyeballs. So you have to do a really good eye exam on your patients to make sure they don't have any of this stuff. Tertiary injuries now are, as that blast wave comes past you, it's picked up all that junk, dragged it and thrown it into you. You now become that junk and you get picked up and thrown along with the blast. And if you're thrown into a wall, that's probably going to cause a blunt injury. But if you're thrown into a pitchfork, that's probably going to be a penetrating injury. So tertiary injuries can also be blunt or penetrating, either one. It's probably most likely it's going to be blunt injury, but it's not impossible to have penetrating injuries as well. All right, so secondary injuries, no, we went backwards. Better. The quaternary injuries are anything else that you get caught in from the explosion. So these are like your burns. If you're really close to the detonation, you could get burned, but if you're farther out, you probably won't. There could be toxins released. You know, when chemicals burn, they cause cyanide. That's all part of your quaternary injuries. Asphyxia, crush injuries when the building falls on you. That's all quaternary injuries, PTSD, psych stuff. and even exacerbation of underlying conditions. If you have diabetes and can't get your insulin because there's no way to get to a pharmacy, there's none around you, that's also considered part of the quaternary injury. So the quaternary injury is listed as injuries that are directly caused by the blast, not caused by the blast, but related to the event. Right? So they're not the actual primary, secondary, tertiary injuries. They're stuff caused by the event. I did read one place where the Department of Defense has something called a quaternary injury, which they're the only ones that I saw that use this term. And this is when there's something spread by the blast, such as sarin or anthrax or radiation. But nobody else uses this terminology. Just know that it's out there, but Department of Defense uses it. So if you're going to be at a blast site and you're going to be taking care of patients, you have to use these precautions that you don't get contaminated, right? So universal precautions, you want to have PPE on, defends you from chemical, biological, and radiologic disasters. Most of the EMS guys have CO2 detectors and radiation detectors that they wear in that little yellow unit on their belt. So if there's radiation there, those guys will probably know about it way before you do, and you won't be allowed in the area. But just realize that you have to make sure the area is safe for you to go into, and you have good PPE on before you go in there. So what's your workup? You obviously want to do a good H&P. We talked about the areas of your body that are important to examine, like the ears, the lungs, the belly. And then you want to get basic labs, probably pre-op labs if they're going to think they're going to be going to the operating room. Almost everybody that's caught in a blast deserves a chest x-ray unless they're not near the blast, if they're far out. But you want to look for blast lung when they may not say they have any specific symptoms except for a little bit of dyspnea. CTs of the head, CTs of the belly probably for a lot of them. And then extremity films for whatever could be broken or harboring foreign bodies. You want to get that. We could talk quickly about a couple specific injuries to blasts, like crush injury. Here you want to make sure they're well hydrated, because the hemoglobin that's released from the muscle breakdown, or the myoglobin that's released from the muscle breakdown, is a poison to your kidneys. So if you don't keep them hydrated, they're not going to do well. You also probably want to give them a fluid that's basic. So you want to make sure that they have a good urine output and their pH is nice and high when you test their urine. These people may require dialysis because myoglobin may shut down the kidneys. And you want to try and get the fluid started even out in the field. I've seen a lot of times when people are trapped in crush situations, they'll have the IV started before even the rubble is pulled off of them. So they're getting IV fluid while they're being extricated. This is really good to stay away from kidney injury. And then obviously you want to consult your trauma guys. You want to look at their mangled extremity severity score, because sometimes there's just too much crush, and no matter what you do, you're not going to save the limb, and it may require amputation. I believe it traps myoglobin in the urine and helps you avoid kidney damage, but I'd have to look it up to get back to you specifically why it happens. Burns, we've already talked about this at some point today. There's first, second, and third degree burns. You want to use your Parkland formula to figure out how much burn fluid they get, and this is added on to maintenance fluid. But just make sure they get enough fluid, because they're going to lose a lot through the burn surface. Remember again that first degree burns don't count towards their Parkland formula fluids, because you don't really lose fluid from first degree burns. If you guys get a sunburn, you're not oozing fluid out of it unless it's really, really bad, and then it's probably heading towards second degree. Think about who needs to be transferred to a burn center. Like we talked about earlier today, there are very few burn beds in New York City. And in the time of a disaster, when there's a lot of patients requiring them, it is highly unlikely that we are going to get precedent for the burn beds, because the other people who are affiliated with those places are probably going to go before us. So we may be stuck dealing with these patients and taking care of them ourselves. Realize too, you can inhale a bunch of toxic stuff when you're in these explosions. Carbon monoxide and cyanide are the big two. Carbon monoxide requires oxygen therapy, sometimes hyperbarics, depending on what their levels are. And then cyanide, you're going to use hydroxycobalamin. There used to be the Lilly kit, which I'm sure you guys have heard of, but I don't even think they sell them anymore. I don't think we can get to them anymore. They just give hydroxycobalamin because it's just so much easier to deal with and so much easier to give. If EMS gives it, they will almost always draw blood first and give you the blood, because the hydroxycobalamin turns your blood red. And all the colorimetric tests that we do in the lab will change those tests. And it's not all tests, but it's just the colorimetric ones. So let's review. Blast injuries have a big positive wave and then a negative wave behind them. They have high order and low order explosives. The blast injuries are primary, secondary, tertiary, and quaternary. And IV fluid for crush injuries. Burns, go to a burn center if you can get them there. And don't forget your antidotes for cyanide and carbon monoxide. Anybody have any questions?